Hello all, let's see the anatomy of the sternocleidomastoid muscle. Before going into detailed anatomy of the sternocleidomastoid muscle, let's see few clinical cases. In clinical case number 1, a newborn baby having head bent to one side and the history of the forceful labor was there. It was diagnosed with wry neck which occurred due to shortening of this sternocleidomastoid muscle. In the second case, a person who traveled to very cold environment came to OPD with bending of the head to one side and he was diagnosed with spasmodic torticollis. So in both the cases, the sternocleidomastoid muscle is the prime important structure, and that's why let's see the anatomy of this sternocleidomastoid muscle. So here in this figure we can appreciate that this muscle, it is the sternocleidomastoid muscle. In short name, this sternocleidomastoid muscle, it is also called as sternomastoid muscle, as this muscle passes obliquely in the neck, and that's why it divides the neck into anterior aspect of it and the posterior aspect of it, named as anterior triangle and the posterior triangle respectively, and that's why this muscle is the key muscle of the neck. When we see the origin of this sternocleidomastoid muscle, as the name suggests, it is going to arise by the two heads, one from the sternal head and one is the clavicular head. And here in this figure we can appreciate this is the manubrium sterni. The sternal head, it is going to arise from this manubrium sterni anterior aspect as a rounded tendon, and the clavicular head, it is going to arise as fleshy fibers from the medial 1/3 of the clavicle from its superior surface as well as from its anterior surface. And the gap between the two heads, it is called as the lesser supraclavicular triangle. This clavicular fibers of the sternocleidomastoid muscle, it passes upward and going to fuse with the sternal head from its posterior aspect and going to form a single belly. Between the gap of the sternal head and the clavicular head, we find the termination of the internal jugular vein. As this muscle passes upward and backward and going to insert over the mastoid process as well as the superior knuckle line to its lateral 1/3 part. So this sternocleidomastoid muscle as having two origin from the sternal and the clavicular part and going to insert over the mastoid process as well as the lateral 1/3 of the superior knuckle line. So ultimately we can say that there are four types of the fibers we can count within the sternocleidomastoid muscle, and these four types of the fibers, they are the sternomastoid part, sternooccipitalis part, cleido-occipitalis part and cleidomastoid part. Out of these four parts, this cleidomastoid part, which is going to cross the remaining three parts, and that's why this muscle, it is the cruciform in nature. And one important thing to understand that between these two parts, the cleidomastoid part and the remaining three parts, this spinal accessory nerve is going to pass and it is going to supply the sternocleidomastoid from its deep surface, and then it come out from its posterior border to enter into posterior triangle and going to supply the trapezius muscle. So when we see the nerve supply of the sternocleidomastoid muscle, it is going to be supplied by the spinal accessory nerve as the motor nerve, and the proprioceptive nerves from the sternocleidomastoid muscle, it will be carried by the ventral rami of the C2 and C3. Now let's see the action of this sternocleidomastoid muscle. When the sternocleidomastoid muscle of one side get contracted, so we can say unilateral contraction of this sternocleidomastoid muscle will lead to the bending of the head to the same side as well as this bending of the head to the same sides will ultimately drain the chin to the opposite side. When the bilateral contraction of this muscle is there, this muscle is responsible for the protraction of the head and this make the head forward, and this movement is very much important in day-to-day life activity. When this sternocleidomastoid muscle acts from above, it is responsible for the elevation of the thorax, and that's why this muscle is responsible for the accessory muscle of the inspiration. So all these are the action of the sternocleidomastoid muscle. Now let's see the relations of the sternocleidomastoid muscle. And for that, let's see the superficial relations of the sternocleidomastoid muscle. Here, this is the figure of the extended neck with its lateral view, showing the superficial relations of the sternocleidomastoid muscle. So here, this muscle is the sternocleidomastoid muscle, and on the posterior side we can find this is the trapezius muscle. Here on the superficial aspect we find the skin, superficial fascia, and within the superficial fascia we find the platysma muscle and the deep fascia investing layer, which is also going to enclose the sternocleidomastoid muscle. So here we have removed all the superficial relations of the sternocleidomastoid up to the deep fascia, and just deep to the platysma muscle we find a very important vein, and this vein, it is the external jugular vein. This external jugular vein, it is going to be formed by this posterior division of the retromandibular vein with this posterior auricular vein. Few other superficial relations of the sternocleidomastoid muscles are there, and one of them is this nerve, and this is the great auricular nerve. This great auricular nerve having the root value of ventral rami of C2 and C3, and this great auricular nerve is responsible for getting the cutaneous sensations from the angle of the mandible. One more content in the superficial relation of the sternocleidomastoid muscle is this nerve, and this is the transverse cervical cutaneous nerve. The root value of this transverse cervical cutaneous nerve, it is also C2 and C3. So here are the most of the superficial relations of the sternocleidomastoid muscle. When we see the structures passing from the posterior border of the sternocleidomastoid muscle, we find important nerves, and one of them is this spinal accessory nerve, and which is looped superficially by this nerve, and this is the lesser occipital nerve. This lesser occipital nerve having the root value of ventral rami of C2. One more structure which is present on the posterior border of the sternocleidomastoid muscle, it is this cutaneous nerve, and this is the trunk of the supraclavicular nerve, which will further divide into three branches into the medial, intermediate, and the lateral supraclavicular nerves. When we see the anterior relation of the sternocleidomastoid muscle, we find this important vein, and this vein, it is the common fascial vein, which is going to be formed by the anterior division of the retromandibular vein with the fascial vein. And this ultimately common fascial vein is going to drain into this deeper structure, and this structure, it is the internal jugular vein. Ascending and the descending branches of this transverse cervical cutaneous nerve, they are also present within the anterior border of the sternocleidomastoid muscle. So all these are the superficial relations along with the anterior border and the posterior border relations of the sternocleidomastoid muscle. Now let's see the deep relations of the sternocleidomastoid muscle. Here in this figure we have cut and reflect the sternocleidomastoid muscle, and we can appreciate the deep relations of the sternocleidomastoid muscle. For the deep relation of the sternocleidomastoid muscle, we can divide these relations into three parts by these two tendons. This is the posterior belly of the digastric muscle, and this one is the superior belly of the omohyoid muscle, into three parts. The part above the posterior belly of the digastric, the second part, that is the middle part between the omohyoid and the digastric muscle, and the lower part which is situated below this omohyoid muscle. When we see the deep relations of the sternocleidomastoid to its lower part below the superior belly of the omohyoid, we find the carotid sheath over there, and within the carotid sheath we find the common carotid artery, internal jugular vein, as well as the vagus nerve. So here this structure is the common carotid artery, this one is the vagus nerve, and the vein which we can appreciate, this is the internal jugular vein. At the lower part of the triangle we find along with that the subclavian artery, which is somewhere present here. In the deep relation of the sternocleidomastoid below the omohyoid, we find the anterior jugular vein, and this along with the anterior jugular vein we find the infrahyoid muscles also. So here this is the one of the infrahyoid muscle, that is the sternohyoid muscle with this anterior jugular vein. When we see the deep relations of the sternocleidomastoid between the omohyoid and the posterior belly of the digastric, we find the major three structures of the carotid sheath which we have already discussed. These are the internal jugular vein, common carotid artery, and the vagus nerve. And along with them we also find the loop of this ansa cervicalis in front of the carotid sheath. Along with this we find the branches of the superior thyroid artery and the occipital artery to the sternocleidomastoid muscle, which are also passes deep to the sternocleidomastoid muscle. Along with this, all these structures within the middle part of the deep relation of the sternocleidomastoid muscle, we appreciate the floor of the posterior triangle muscles, which are also overlapped by the sternocleidomastoid muscle, and these are the splenius capitis, levator scapulae, as well as the scalene muscles. When we see the deep relation of the sternocleidomastoid above the posterior belly of the digastric, the main relation it is concerned with the muscles attached with this mastoid process, and along with them we also find sternocleidomastoid muscle crossed by the occipital artery, which is one of the branch of the external carotid artery. The spinal part of the accessory nerve, as we have already discussed, it is going to pierce the sternocleidomastoid muscle between the cleidomastoid part and the rest of the muscle, and that's why this spinal accessory nerve, it is also lying deep to the sternocleidomastoid muscle in the upper part. So all these are the important relations of the sternocleidomastoid muscle. So hope you understand well. Thanks for watching.